Awesome. It is 3:02. Thank you all so very much for making the time for this webinar today. I'm very excited about the topic and the panelists that we have. I'm especially excited about the topic because RTCT, which is the Residency Training Collaboration Team, is what this organization was built for. I remember when I joined this organization in 2010 and the leadership at the time talking about this faculty bank, a bank of faculty that would be available to the Ghana College to assist with the training of residents and fellows, and to see it come to fruition over these many, many years is a very, very exciting thing. Again, it's the reason why we exist as an organization, to be able to contribute to the education of our brothers and sisters, our residents and fellows back home in Ghana, in partnership with the Ghana College. So I am excited about the great panelists that we have today. Some of our RTCT leads that have done amazing work to push the mission of their specialty group forward. So you're going to hear a lot about that today, about some of the successes, some of the challenges, and how some of these teams have gotten started. My hope is that the audience will walk away excited and energized to get involved with their own specialty groups related to the RTCT program. There is still lots of work to be done. We've made a lot of great progress, but I want you all to listen in and get involved where you can. We have Professor Henry Lawson today serving as our moderator. He is the Vice Rector of the Ghana College of Physicians and Surgeons, and I'm very, very excited that he is here to join us today. But before we dive into the conversation, we have Patricia Ampedu and Nick and Ni Ankara, who will give us a brief presentation on what the RTCT program is all about and how what the different roles are and the progress that we've made thus far. So take it away, Tricia.
Okay. Can you see me now? Okay. So can you see my screen?
Yes, we can see your screen.
Yes.
Awesome. Okay. Let me put it. All right. So the Ghana Diaspora Residency Training Collaboration Teams is an initiative that was set between the Ghana Physicians and Surgeons Foundation of North America, the Ghana College of Physicians and Surgeons, the Ghana Doctors and Dentists Association of the UK, in partnership with the Medical and Dental Council Ghana. And the aim, an MOU was set between these organizations to drive the initiative of RTCT with the aim of supporting with residency and fellowship training in Ghana. So they make up our collaborators, and without them, these groups, the work that we do today will not be successful. Here are the faculties that exist at the college. We have the Division of Physicians, which includes internal medicine, laboratory medicine, including hematology, Division of Surgeons, which includes neurosurgery, ophthalmology, and in 2025, radiology, oncology, and radiation radiotherapy faculty became separated, and so they exist as separate faculties. Okay. This is how the RTCT operation works like. It serves as a bridge between the Ghana-based faculty and then the diaspora-based faculty. And by diaspora, I mean the North America and then the UK. Here is a model for the RTCT group. Each faculty will consist of a lead group, or we're made up of a lead group and faculty members group. The lead group is a smaller group, which is made up of members from Ghana, North America, and the UK who have interest in taking on lead roles for their faculty. And the faculty member group, they will be members or individuals, all other individuals within a specialty group helping with RTCT initiative and driving the goals for the RTCT. So the collaborators for this partnership, they are outlined 6 thematic areas that each faculty can use or serve as a guide to guide their framework of operation. And that includes providing lectures, virtual or in person, to residents and fellows, providing clinical training to them in hospitals in Ghana, securing external rotations for residents in hospitals outside Ghana, and providing research supervision for them, serving as mentors to the residents, or even serving as examiners on the residency exam board. Now I'll pass it over to my colleague Nee to continue with the rest of the presentation.
Thanks, Trisha. Good evening to everyone. My name is Nee Ankra, GPSF Admin Assistant, Ghana-based. Moving on to the role of a lead, the RTCT faculty lead plays a crucial role in overseeing and coordinating group activities. Key of the responsibilities include leading discussions on implementing thematic areas such as providing lectures to residents in Ghana, securing external rotations for Ghanaian residents outside Ghana, research supervision and mentorship. Additionally, faculty leads foster partnership with stakeholders. Stakeholders in this regard include potential and existing diaspora in Ghana faculty members in specialty, as well as those in other RTCT groups and GCPS, GPSF leadership. Further responsibilities include addressing implementation challenges, monitoring and evaluating training program effectiveness, and collaborating with coordinating leads to ensure progress of their faculty. One important thing to note is that faculty leads are not meant to do this all by their own. We recognize your busy schedules, and so Trisha and I would constantly be in the picture to provide support and guidance to ensure progress. Next, let's discuss the role of faculty members. Faculty members are individuals within RTCT group helping with the RTCT initiatives and actively engaging in activities outlined in the faculty frameworks. Their responsibilities include participating in meetings to drive progress, volunteering for tasks such as providing lectures or training opportunities for Ghanaian residents. And also, faculty members are expected to recruit additional members who are interested to support our goals. We proceed to the next steps for initiating an RTCT group. This process begins with identifying key leads or focal persons in Ghana and in the diaspora who will take on pivotal roles. Step 2 is the initial coordination. After leads have been identified, they will have to set up initial meeting to discuss training needs and potential supplementation from faculty members. The next step is to define a working structure where leads will establish a meeting cadence and build their operational framework. Afterwards, regular meetings will be held to discuss training needs, recruitment efforts, and progress towards faculty objectives. Trisha and I, as coordinators, are committed to supporting you throughout this process, and we will be delighted to assist you in starting a lead role. Please don't hesitate to reach out. Slide. Let's review the progress of our faculty groups. 4 faculties have successfully implemented frameworks. These are Pediatrics and Child Health, Radiology, ENT, Public Health, and Research. These groups are active and have designated leads, and they hold regular meetings. It is worth highlighting that ENT has implemented their framework although they don't meet frequently. On the other hand, we have lead groups that meet regularly, as listed on the slide. We are excited to announce that Public Health will host its maiden virtual lecture on April 22nd, 2025. Details will be shared soon. Further progress updates show that some specialty groups, including internal medicine, surgery and subspecialties, obstetrics and gynecology, have established leads and initiated meetings. These groups aim to achieve measurable progress before scheduling recurring meetings. However, we currently have faculty groups like emergency medicine, neurosurgery, orthopedics, ophthalmology, and psychiatry who are without leads. And to drive progress in these faculties, we are actively seeking leads to champion our initiatives. Tricia will elaborate on how you can sign up to take a lead role and contribute to our success. We are eager to engage with members who share our passion and vision. So please consider taking a lead role. I'd like to hand over to Tricia, who will take us through the next step. Thank you.
Thanks a lot, Nee. So this is the faculty interest survey form that we have. It's a brief survey that we put together for interested persons here today and beyond. But we would really want you to sign up for an activity, and we'll reach out personally to you and get you on board. Even if it has to do with just being a mentor to a resident, or if you're someone who just wants to give one lecture and not get involved, we have a place for you. So we'll encourage you to sign up for this. You do not need to be a GPSF member or a GDDA UK member to sign up. So hopefully we'll get a lot of people on board here to sign up. Thank you.
Thank you, Nee and Tricia, for that presentation. Very, very helpful. The MOU between the Medical and Dental Council in Ghana and GPSF, and a separate MOU with GDDA UK, is to provide licenses for us. The reason we need those licenses is try to help with those work. So that's why we established those MOUs, to try to also advance the work of the RTCT program. So I'm going to stop there. We'll take questions at the end, but please feel free to put questions in the Q&A and we will address them at the end as well. I'm going to now pass it over to Professor Henry Lawson to take over.
All right. Thank you very much, Fran. I would like to thank Fran and the team for this opportunity. Usually it's the rector who has been involved in this program. Unfortunately, he's away on leave, and he has asked me to represent the college, and I'm happy to do this work. So for my panelists, there are some questions I'll be asking. So this first question goes to everybody. So if we listen and then we just go, I'll just mention your name and then you pick it up. So you're going to tell us your name, your specialty, and then the institution where you work. So if we can start, anybody can start, and then we can take it from there. So all the panelists, kindly tell us your name, your specialty, and then your institution. Okay, Patience.
Hi, everyone. My name is Patience Afulani. I am an associate professor at the University of California, San Francisco, in the obstetrics and gynecology department, and also in the epidemiology and biostatistics department. My role is primarily research, and I conduct research on maternal and child health and person-centered care, with an interest in how social and health system factors influence outcomes. Should I stop there and come back?
Yes, stop. But what's your specialty?
So that's a good question. My specialty is public health.
All right, thank you. All right. Clenham.
Thank you. I'm Glenham Jeffy Tete, a consultant radiologist and associate professor at the University of Health and Allied Sciences, affiliated to Kolebu Teaching Hospital, immediate past head of department. And I'm also I was a faculty secretary and now the acting faculty chair of radiology. And radiology, we now split it from radiotherapy. So we have faculty of radiology and now faculty of radiology, oncology, and nuclear medicine, which is separate. Yeah.
All right.
Thank you.
Thank you. Jolene.
My name is Jolene Daco. I'm a neonatologist at Atrium Health, Levine Children's Hospital in Macon, Georgia.
All right. Thank you. Nikone.
Hello. You guys all hear me?
Yes, we can hear you.
Great. So Nikone, I am an diagnostic and interventional radiologist. Currently, more or less work for myself, but most recently I was at Kaiser Permanente and Oregon Health Science University out in Oregon.
Thank you. Irene.
Yeah. Hi. Yeah. Okay. Hi. Hi. Good evening. My name is Irene Japong, and I'm a public health physician. My area of specialization is health policy systems, and I currently chair the Faculty of Public Health, but I also how do you say it? We have a research center in the college now. We are trying to strengthen research as part of the college. So I am co-director of the NHR Global Health Research Center for Non-Communicable Disease Control in West Africa. Thank you.
All right. So welcome everybody. I think Professor Enimil has not been able to join us. So we will do pediatrics last. If at some point he joins us, then we will go ahead with him. So Ni, I think I'll come to you first. So radiology. Tell us your story, when you got started, your successes and your challenges so far.
Certainly. So on the radiology side, we're one of the first groups to really get going. Just if I could walk it, how far back to go? All right, so I'll try to keep it simple. So we're one of the first groups to get going. When the MOU was signed, this is back when Dr. Ayi was chair. There was a lot of excitement because, as Fran said, we have been, this is a big part of why the GPSF exists. So to finally get to the point where now we can be directly involved with residency training and also a pathway for folks here to be able to get licensed to be involved directly in healthcare back home was huge. And you probably hear this as a recurring theme, everybody everywhere is busy, right? So there really wasn't much being done. I was in Ghana after my father had passed and speaking to Bertha, wondering, hey, I want to do more. How do I even get licensed here? And that's when I learned about the MOU. And so that's really where this really got started. And she, knew of my interest in trying to do more work in the radiology space. And she told me, hey, is this something you can help us with? So connected me with Dr. Jeffy Tete. I met her while I was there. So another theme you'll hear here is that personal interaction is really important. Meeting in person made a huge difference. Getting to know each other was important, right? And then sort of building from that vantage point. So I met with her, and then from that point, we started to collaborate. Key thing is, we and the RTCT essentially serve as a bridge between the trying to get a faculty group here in the diaspora and a faculty group in Ghana. So we had already started doing some outreach to connect the Ghanaian radiologists here. So we brought that under this umbrella. And as you learn and talk to people, you learn about, everybody has a real passion to do this work, and people have already been doing stuff on their own or through other groups. So it's how do we sort of harness all of this energy and bring it together, and also not necessarily do redundant work, right? So instead of working in silos, let's get a sense of what everybody's doing. You don't necessarily need to build anything from scratch. Through this process, connected with Dr. Ama, who had been doing lecture series, connected with Dr. Jazzy, who's also been doing lecture series in Ghana. So it's how do we now all get together and do this as a group? And so some of the frameworks were already in place to be able to offer some of the things that folks in Ghana wanted us to do. And so I'll highlight some of the work that Dr. Ama was already doing, for example, where he would regularly meet with all the residents in Ghana and do a lecture series, all the radiology residents. So we're able to join him and sort of, and try to move that along. The difficulty then and now has always been getting commitment from folks to be able to provide these lectures, and that remains. But it's something that we're hoping that will overcome as more and more people become aware. Another approach that we've used to deal with that has been opening this up to not just folks from Ghana. So you do have a lot of folks who may be from elsewhere but have an interest in residency training, or maybe particularly good at providing lectures on any particular topic. And so we use that as when we talk to our Ghanaian colleagues, and they may, from the residents or from the faculty, they may mention there may be specific topics that they really want us to focus on. We can then go back through our diaspora and figure, is there anybody here who can do this? And if not, do you have connections outside of this group that can help us with this? So that's just another way where it expands the pool of folks that allows us to not be too burdensome. I think I could go on for a little bit, but the main points I want to highlight here are that, one, trying to get started doesn't take much. It's really the personal connection. So there are folks on both sides of the Atlantic who have an interest. So connecting and making that connection, making that personal thing makes a huge difference. Two is you do as much as you can to begin with. So we're not to make this too burdensome, right? So you just set the boundaries of what you're able to offer, and you set your cadence based upon that. And then the third thing is, this should be fun, right? So for me, example, just getting to know all the other radiologists here in the US is a huge plus, building your network. And then through that, also getting to know your fellow Ghanaian radiologists, it's another huge plus. So just that network alone is something that you cannot replace. So making it fun, getting to know each other, building that community is the other bit, that really starting there. And then the rest of it is sort of layered on top of that. So those are the kind of main points that I think I want to make on this, and I'll pass it on for now.
All right, Nee, thank you. Thank you very much. Plenam, do you want to top it up briefly, a minute or two?
Sure.
Hello, Plenam, we can't hear you. Good.
Webinars fortnightly, which is so insightful. Yeah. And this was also in collaboration with RAD-AID Ghana, which Dr. Ama is part. And the residents really, really appreciate it so much. And for now, what we are really also interested is, Professor Ama is here. He just said, yes, he's been very useful, instrumental in these webinars. And now the residents need places for external rotations that they can go into observerships. Yeah. And we also need external examiners that can take part in our exams. So, thank you so much.
Okay.
Yeah, it's been really good. It's collaboration.
All right.
Yeah.
And so
Thank
just to
you.
highlight
Thank
that, before we move on to the other faculty, so that's just an
Hey,
example.
radiology. Let others
We have a lot to talk about.
We'll
huh?
come back. We'll come back. We'll come back.
Yes, sir. Okay, I'll shut up.
All right then. Okay, thank you so much. So I think I want to move to public health. Patience, if you can start off, tell us how you started off. What are some of your successes and your challenges for now? Yeah. And anyway, before you go on, I'd like to acknowledge the presence of Sandra Kwarting. She's representing Professor Enimil, Faculty of Pediatrics. And then we also have Professor Ama, who his name has been mentioned by both radiology speakers. So they are online. So we're happy to have you. Please go on, Patience.
Thank you. I will start, and I'm sure Fran can add on to this. I was actually thinking, and I'm not sure how I became the lead for this group, but maybe Nee asked me. I remember it was initially when he was circulating the list, trying to gather interest from various groups. And did you ask me? Maybe. But I think the radiology group certainly got things started, and he started reaching out to other people. And I think that was how I got involved with the public health group. And we started off really recognizing that we had very few purely public health folks in GPSF. And so it would be a stronger group if we extended it as a public health and research faculty, such that faculty in other areas who are involved in research could also support this group. Our initial activities really just focused on assessing where our expertise was, so in what areas we could contribute. So we sent a couple of emails out with links asking people to fill in and let us know what their research expertise was and how they could contribute to this group. And then we started to organize a couple of meetings, initially just with the GPSF side to figure out how we could contribute. And then we got connected with the Ghana Public Health Faculty. And Dr. Dovlo was the lead at the time, and he was really invested in this. We had a couple of meetings with him earlier on and subsequent meetings involving other faculty. I also had the opportunity to meet with Dr. Dovlo in person when I was in Ghana. And we came up with some ideas for how we could move this forward. So some of the areas we discussed initially was really starting to think about how we could contribute to teaching, and then also to sort of supervision of research projects, serving as either supervisors or mentors for residents. And we did also discuss potential collaborations or research collaborations between faculty here and faculty in Ghana, and following several meetings. Starting with webinars was like the low-hanging fruit for us. And so we decided that we will start with some webinars. So as of now, we have a couple of speakers lined up who can provide webinars on various topics. And as Patricia mentioned, we have the first one coming up in about a week on viral hepatitis. I should say that Patricia has been incredible in getting that set up. As mentioned, we all are very busy and it's hard to do a lot of the coordination. But I think once we identify the people who could lead the webinars and identify topics, really she took it off and ran off with that. We won't be able to do this without her. So the main thing we have upcoming now is the webinars. For teaching, one of the things we discussed was we really don't know what the teaching needs are and what particularly is needed. A couple of things have been shared with us. And the idea is that when the Ghana Public Health Faculty identify a gap, they can reach out to us to see if we have the expertise to fill in that gap. We also did acknowledge from the beginning that we didn't want this to be something that we just decide among ourselves that this is what we want to do and we want to implement it, but really want to be responsive to what are the areas that there is a gap or there is a need that we can contribute to. And I'm hoping that we can continue with that as we begin to work with Prof. Irene, who is now the lead, really thinking through how we can support, because we want to play a more supportive role rather than taking lead in moving this forward. Similarly, with research supervision also, it is the same, that once you identify any gap areas that you think that faculty here might be able to support in the supervision, then we can look among our faculty here to see who can help with that. Let me stop here and maybe Frank can add on.
Now
All right, thank you.
you mentioned one of the biggest points, and that is not imposing, us on the US UK side, imposing what we think the college needs or what the residents and fellows needs, but this is a collaboration between the two teams, right? And being able to provide lectures or whatever the different thematic area that we choose, that we do it in collaboration. So this webinar that's coming up, the way we set it up is we have Dr. Lewis Roberts, who is a US-based expert in hepatology. He's giving the lecture, and then we have a discussant that's based in Ghana, and we also have a moderator that's based in Ghana. So we never wanted to just be one-sided where it's just the US folks that are, or the UK folks that are just doing all parts of it. This is a collaboration, and we want to make sure that it continues to be that way. So very, very excited. And yes, I definitely want to give praise to Tricia, who has been here for, I think, over a year now, and has been doing an amazing job getting everybody started. Nee Ankara has now joined her as well, and it's been a very, very productive process. So I'll shut up and you can go on to the next week.
All right. Irene, do you have anything to add so far?
I will say that I actually think this is a great initiative. Dr. Delodevlo was the chair of the public health faculty, and within public health, we agreed that this is so important. We'll let the chair kind of play a major role. I've taken over as the chair now, and I'm kind of trying to come up to speed and step in. But I do think it's a great initiative, and perhaps there are things pending that I need to discuss, such as, is there a list of people willing to be research supervisors with their areas of interest and expertise? Because so that we let fellowship residents know, because we are trying to move to a system where fellowship residents should identify a supervisor team very, very early on. So this is one of the really great potential areas that if you have such a list, I think would help. And yes, so it's a wonderful initiative. Yeah, it's
okay.
yeah.
And then if I might quickly add, the external examiner zone is also a very useful area for these teams. Right. So pediatrics, Jolene.
Yes. So I'm not here alone. I know Dr. Sandra Patingowusu is in the audience.
That's right.
From here, but he had another engagement. So she's also here with me to support this. But again, I'm kind of the accidental lead for this group. We are a group of 4 now. Elijah Paintel, Yao Apieje Danka, and Yao Samoa Bonsu, who joined us a little bit later to kind of help us to make sure that we always had, quorum anytime we decided to meet. And I must commend our Ghana-based colleagues, Prof. Goka, Dr. Neza, Prof. Enemil, because they really were very transparent in the beginning. They were able to identify the key areas where they needed support, and our goal was to try as much as possible to support them in those areas. So that's really what we've been focused on doing. We have a WhatsApp platform. I feel like we have open communication, and that really helps us to achieve a lot of our goals. Professor Samson Entry is also on the platform, and he's also been involved in the meetings and the discussions, and that's really helped us to move a lot of things forward.
All right, thank you. There are a lot of people on the platform, and we acknowledge all of you for coming. We have the lead for internal medicine. Trying to find he pushed his name there. Yes, Dr. Kwesi Kakari. He's on the call. We also have Robert Nunu. We have Jeanette Bohine. All these people are working behind the scenes, but today we are trying to focus on these 3: public health, radiology, and pediatrics. I'm sure, Fran, now that you've seen this, your next webinar should be coming up real quick before you leave this chair. You must have one more before you go away, so that the other groups get an opportunity to share this, and then people get to see what's going on. When things begin to move, it's easier for people to join. But when you come and say, we are trying to do this, we are trying to do this, we have ideas of doing this, well, do it and let's see it. But now that they've seen Conde is doing something, it's gotten somewhere, they've given some lectures, it makes it easier for people to just join the background again, then things get much better than we started. So with the time that we have left, can we just focus on maybe in the next 3 to 6 months? What do you think your team can do in the next 3 to 6 months? What tangible thing do you think your team can do? So any faculty that is ready can take it and start. What exactly do you think you can do with all that you've gone through now, the experiences you've had, the responses you've had? What do you think in the next 3 to 6 months, we can just come back and say, well, I'm reporting on these 2 things that I said I'll do, and then we know how far you've gone to. So anybody can start.
I can go and start. So with public health, we continue to meet monthly. We have our monthly meetings, and because we have been consistent with our meetings, we've already been able to set up what our next 6 months would look like. We have a few lectures that are already in place where we have our presenter, moderator, and discussant. So we're trying to do our lectures or our webinars quarterly. So we have essentially the rest of the year mapped out in what we will provide. So we'll continue to meet and continue to plan for the lectures even after the 2 that we have planned. So I think the partnership has worked very, very well. And as Prof. Irene says, there's other areas that we also want to tackle. So as we meet regularly, we'll continue to start to tackle those areas. Patience, you want to add?
Patience, anything to add?
No, that's it. The webinars are what we have lined
We're
up.
going to start with now. All right. Okay. So who's next?
For pediatrics, we initially had some challenges with being able to deliver the core lectures that were on the curriculum. But I want to say these colleagues handled that expertly, like that's covered. But now we have the opportunity to also deliver lectures from the GPSF groups, just in their areas of interest and expertise that we believe will be helpful to the training program. So we have that, and we're working on that schedule. So in June and July and August, we have maybe about 6 to 8 lectures that are lined up, and we're going to deliver those to the pediatric faculty.
Okay. All right. Okay. Thank you very much. Radiology. Next 3 to 6 months.
It's short, but you know me, I talk.
We have time, you can talk.
So in the next 3 to 6 months, I think the main thing for us is that we started off, and initially we were having more regular lecture series, and that sort of tailed down, and we are revamping that back up again. So we're getting back to more regular lecture series. And then as Dr. Jeffrey Tete mentioned, one of the areas, or 2 of the areas that have been coming up has been this help with getting people external rotation. So we've been working hard on our end to try to open that up for folks. And we know that if we can get that open in any one institution, maybe it'll be for radiology, but it then opens the door for other faculty as well to be able to work within that institution. So that's been an area of focus now of how do we get people some of these externships and observerships. And I'm hoping that within the next 6 months, we should at least be able to get somebody here. It's taken a lot longer than we initially thought it would, but we're also in a very different environment today with everything going on with the one with visas and also just with the university systems and their funding. It's going to make it a little more difficult in this current environment, but not impossible. So that's an area of focus. External examiners, we haven't quite, that's something that should be readily available. We haven't quite focused on it yet. So it's something that, as with enough head time, it shouldn't be that hard to find faculty to help with that. So I'll leave that for now. So lectures back up and being wrapped up again, and then external rotations are the other areas. And I should mention, this all comes from talking to your colleagues back in Ghana and understanding what the real needs are, so that you can then focus your energy on where it would make a difference. And so I think that's just something that all the different faculty every faculty may have a different approach to the way to do this. We should all each other though.
Thank you. Glenn, anything in the next 6 months?
Yeah, those are the things I mentioned earlier. He has emphasized the external rotations for the residents and the external examiners. Yeah. For exams.
So if I can chip in, we have some examples of very beautiful external rotation agreements Faculty of Psychiatry has this wonderful collaboration with University of Dalhousie in Canada. And actually, when the residents go, they are employed as residents within the program, and they get an allowance throughout the period that they are there. So that's the extent to which some of the collaborations have gone. That it's tough, but some way, somehow, they found, different groups have found a way around it so that the experience is meaningful. And it goes from observerships where you're not touching anybody to the extent where the Dalhousie group has gone to. But we believe in the college that every senior resident, before they become a fellow, they must have an external rotation. In fact, sometimes just seeing that when a meeting is 7 o'clock, it actually starts at 7 is good enough for us, that they see that commitment, they see that focus and that sort of practice. Because here you have so many things that can give you an excuse for not doing what you're supposed to do. So many things. The lights can go out. Somebody didn't show up at work on time. Some room was locked, wasn't open. It's easy to find something, but when you get to a system where everything is working, you realign your targets. So once you become a fellow, your expectations become better. You want to move more than what you see in your environment. So the college actually pays for the return air ticket for a resident in the college to go and do this program. So what we look for in a collaboration is for the center, if they can provide accommodation, for example, and maybe transport within, Michigan, for example, you get a pass, you jump onto the bus, it takes you from everywhere. Something like that, which will support the residents while they are doing their external rotation. And we recommend a period of 3 to 6 months. There have been times where some residents have stayed for up to a year because they end up finding things that they are learning that are not available in Ghana. And so the faculty will write to the college that this particular resident needs to stay a little bit longer to experience a certain part of the curriculum which we don't have here. So all those options are available for us to work with. So each time you have a challenge, now that we have Niankra and we are all here, it's easy to come and talk to us. So what can we do with this? What can we do with that? I have this idea. Maybe it's not been mentioned so far. I don't know whether it is possible to use it or not. Then we can begin to engage and look at the best way these things can be done. For the external examiner position, the college has a requirement that if you want to be an external examiner, you shouldn't have been involved in the training of the resident at any point in time. And so for those who do not have time at all, they can come into that zone where they pop up during the exam. We give them the book, we give them 3 months, they read the book, they join an examination online for an hour and a half, and then it is done. So that package is also very suitable for some people who are very busy. They won't get time to give lectures. They won't get time to do mentorship, supervision. They will not get the time, but they can find some time, maybe once every 2 years, to read a book and come and do an examination. So when we are selling the external examiner, let's add this package to it, that it's also another very likable thing. And you don't have to come. You don't have to fly in. It's online. We try and work it out so that it's, we've got examiners from New Zealand. The last time we had a huge challenge fixing the time for the exam because sometimes you pick it and the person is 1 a.m. there. So we have to work around it to find something. But I think that's the most important thing we do. We try and make sure that it's reasonable to the examiner. We also want our candidates to be examined by external people. We've used a lot of Nigeria and South Africa for most of our external examiners, but we are now pushing to get Europe, the Americas, Asia to make sure that the training we are doing is to a certain standard. And it's only when the externals come in that they can point out some of these things to us because they've not been involved in the training, so they can be, very good evaluators of the things that we've done. And Fran, at the end, I'll give you 5 minutes to speak to a lot of questions in the chat space. People just don't understand what we are talking about. They've joined and we are speaking parables to them. So I think towards the end, we'll give you some time to address that before we finally close the webinar. So we do have about 15 minutes.
Moderator, sorry, can I just check in?
Yes.
Yes, Ahan. for now, University of Pennsylvania, Hospital of the University of Pennsylvania, is really helping our residents for this observership. I was there 20 years ago for 1 year.
Okay.
And now residents are going, but
Okay.
we need more other areas, but they have to fund those places themselves, pay for everything, yeah.
All right.
That's
Okay.
the challenge. Yeah.
Right.
Thank you.
Okay. All right. So I was going to ask two questions. The first one was, how far are we along with the UK group, GDDA, in our collaborations? Does any faculty have anybody from GDDA as part of their team? That's the Ghana Doctors and Dentists Association of the UK. Does anybody have?
I could probably be the best one to address that.
Yes, Neem.
And is Trisha still on? Maybe she can add to that.
Yeah, she's here.
So we, at least the groups that I could think of within radiology, we don't currently have anybody from GDDA who's part of it, but I don't think that's mostly a fact of, I'm not sure if there are any radiologists on the GDDA side who are who are interested in being a part of faculty yet. So that's one limitation there. On the other hand, we have certain areas like neurosurgery where we have some faculty who have expressed an interest, but nobody quite willing to take a lead. Whereas on the GDDA side, you have somebody like Dr. I think Nyanzu, Mark, who's already started to, connect with the Ghana folks, and I think he already gave a lecture in that capacity. So part of what I see happening here is some balancing of things that we're not able to offer the GDA may be able to take a lead on, and vice versa. But as far as the full integration, that's in process. Dr. Conrad is on here, and I mean, she's not a panelist, but he was a prior education lead, so he really helped set a lot of the stage for this. And now Mark has taken over and is really going to help us get other people in the UK involved. So we've set the infrastructure, and now it's just a matter of filling it in with folks from across. And Professor Adanu's vision was, again, avoiding people working in silos. The diaspora is broad. So we have GPSF, we're working with GDA, and this is the first test of working across different countries. But then folks in South Africa, wherever else that we have potential diaspora, it's feeding in through this infrastructure that we have set in place. Is sort of the longer term vision for this. So it's really important for us to be working with folks in the UK to really get this thing going.
All right. Okay.
Okay.
Yes.
I wanted to add to what Dr. Kani was saying. Yes, we do have for faculties like anesthesia and dental surgery, we have UK involvement. We have that for obstetrics and gynae. We have that for general surgery and ENT. So yes, we do have the UK involved.
Okay. All right. And then the final question is there room for faculty in these programs, exchange? Is this something that you are considering? Because I know it's called the Residency Training Collaborating Team, but we do have some deficiencies with our faculty that is something that I think I want to throw back to the teams and see how we can work on that too, because Oliver Twist always asks for more. We're doing a lot for the residents, but I'm very sure there are some opportunities that we can give to our faculty so that they also get the exposure and the improvements that they require. Okay, so Fran, maybe I'll give you some time to speak now and then we can round off.
I'm going to give you a PC answer. I think we have to start with our residents, right? Residents will ultimately become faculty, right? So I think in training them, in providing support to them, mentoring to them, they will ultimately become faculty and hopefully pave the way. We have not had those conversations as far as having a separate program for faculty members, but it's something that we can discuss and see where we can pitch in and assist with that.
Okay. All right. So I was actually meant if you could
have,
talk to the comments on the webinar chat space. There are a lot of questions that your members are asking.
We'll get to them in 1 second. Nee, I think you wanted to say something.
No, I was just going to say that some of our, yes, that's not the focus, but some early faculty members for example, I know within interventional radiology, one of the things that we are looking to do is some of the people who are early in their career, having a pathway for them to do additional work here. So that's one of the areas. When I say externships, observerships, I lump that all into that
Okay.
category as well.
Okay.
So I think I've tried to answer some of the questions that were in the chat. Somebody had a question about the rights program. I provided a link there, but essentially the rights program is an opportunity for a resident to come to the United States to glean from the healthcare system here. And it's based in Yale University. And this year we have 2 residents from Ghana that are coming, I think around June, July for that opportunity. It's a 6-week opportunity to be based here and learn about the healthcare system, get involved in research if that's an opportunity. So it's a little bit different from, it's a bit separate from what we're doing with the RTCT program and providing external rotations, but it's similar in some ways. Let's see, and the rights program is not limited to any one specialty. So for example, if radiology had an opportunity for an external internship at one of the hospitals, that would be focused there. But the rights program, anybody could apply to that. We have an application process that ends at the end of December, I think opens maybe September or so. So there will be a call later this year. What other questions did you see, Prof?
Alexander Samoa. He said he's a retired professor of pediatrics, University of Louisville. His subspecialty is in clinical genetics and metabolism. So pediatrics group, if you're interested in genetics, yes. All right.
Selected. I'll send it to you, Jolene.
Okay. And then there's Dr. Kakari or something about palliative care. I think the college palliative care is under family medicine. And so that's Jeanette Bohene. She's looking forward to collaborating there. So if we can follow up on that too. Okay, so I explained the external examiner duties, that basically you are not involved in training, but at the exam, 3 months to the exam, you are sent a book, you mark the book, there's a marking scheme, and then if the candidate passes that, then you join an online 1.5-hour exam. And then you quiz, he defends the dissertation. So pretty much that's what the external examiner does. You also write a report on what you've done so far. Okay. Then Profama, okay, also Profama, they know you very well.
Can I add one more thing?
Yes, Nee, go ahead.
I think the other thing to highlight here, because you brought up this whole thing, say something like University of Pennsylvania and the connections they have with the radiology program, where students are expected to basically take care of all of their own accommodation and everything else. One area that we are hoping to work on is through GPSF and through these various chapters that we have. For example, we have a New York chapter, there's a North Carolina chapter. It's also working through some of these other connections we have to help with tracking. So if we know somebody's coming to Michigan, I'm not sure if we have any groups there, but can they help with that? If we know somebody's coming to New York, can they help with that? So these are some of the areas where, as an organization, outside of just RTCT, we have other moving parts that we can probably plug into this to help alleviate some of the burdens that we experience.
Yeah.
So any last words from the groups?
One thing sorry.
Okay, Jolene, go first.
Yeah, go for it.
I'm just going to say that let's think about this as a two-way street as well. We can definitely benefit on this side from this collaboration. I want to say that through our discussions, a student from here, a resident from Ohio, actually went to Kolebu and completed a rotation. Now, this is one way to, once you open your doors, you have more students come in, then you have more opportunities for collaborations. We did have one opportunity in Maryland that we had to let go because of accommodation and visa issues. So it's a work in progress, but also to help you understand that it's a two-way street. Open your doors and maybe more will come through as well.
Thank you. Thank you.
Great.
Right.
One of the
want to put
Yes, Patience.
Yes, I want to put out the initial call from Tricia. I think you can contribute as little as possible to as much as you want. I've seen several people volunteering in the chat, and I don't know how we are capturing that. I think for people who have specific expertise that they want to contribute, Fran, I don't know if there's a way of sharing our emails for each of the groups, that if you can reach out to the leads for a group that you are willing to support. I saw Dr. Roach, occupational medicine. I think that is public health also. So you're welcome to join our group, and several other comments there. So do reach out to us if you want to contribute to any of these groups.
Yeah, you can either email me, or you can either email the general GPSF mailbox, and we'll get you connected to the right group. So GhanaPhysiciansUSA@gmail.com. Again, GhanaPhysiciansUSA@gmail.com. If you email that with your interest, we'll get you connected to the right group. One other thing I want to mention in the 3 minutes we have left. First of all, thank you all for your interest and your engagement in this very, very important topic. One of the things that we've done within GPSF, I'm not sure how GDDA UK has a function, but once you get your license through GPSF, it is a requirement to serve in one of these 6 thematic areas. So we put in place where you sign a contract to say that you understand by getting the discounted rate and getting the license through GPSF that you agree to participate in one of the 6 thematic areas that we have mentioned earlier. So if you do have your license through us, please make sure that starting next year, it is going to become a requirement in order to renew your license through the organization. But I think many people have joined this organization, whether it's GPSF or GDDA UK, because of your heart to give back to home. This is one of the greatest ways that we can do that. So as Tricia said, as Patience says, whatever little bit you can contribute, we're willing to take. So please make sure, we'll send out the link to the survey. Tricia, if you can put the link actually in the chat for the survey to make it easier for people to click on it and respond now. The people on this call are those that are interested, right? So let's make sure that we capture them even now. So if you could put that link in the chat for people to access, that would be great. I will put the email address for Ghana Physicians, and I'll put my email address as well. Please feel free to reach out with any questions. The goal is to try to make this as easy as possible for as many of you as possible to get involved. And we have great help to do that. So I'll end there. And again, thank you all so very much for joining today. Professor Lawson, I'm going to give you the last word. Before I do, I just want to say we have a GPSF general body meeting right after this. It's a separate link, and it'll be a brief meeting. So please make sure that you join that call as well. Back to you, Prof.
Right. So I think you've done a wonderful summary. I don't need to say anything. I'll just say thank you to the panelists. Also want to thank those who joined us online for this wonderful event. I think we are going somewhere, and we are slowly getting there. Thank you all, and in Ghana, have a good evening. In the US, good afternoon.
Thank you. Good evening.
Thank you. Bye-bye.
All right, thank you all.